Hey everyone, my name is Dr. Zachary Ward. I'm a structural upper cervical chiropractor in Auburn Hills, Michigan, and this is my second video on cervical curve and why alignment matters. This is the shorter video, so if you don't have 10 minutes to watch the other one, you can certainly watch this one. Hopefully we'll keep it under 5. Alignment does matter, and alignment does change in the neck in particular when we're working with patients as structural and upper cervical chiropractors. And so I want to go over a few cases and talk about what they're experiencing so that you can know what's possible. And I have this first case provocatively titled under one correction, and that is because this individual experienced these changes within one visit. I certainly do not advertise that happening for everybody, but when it does happen, it's great. And I certainly felt it as I was working on her, and so I wanted to document it. So here you have the image on the left, that's her before image, and here you have this image on the right. This is the neck from the side, and the neck from the side should have a nice soft gentle curve in most cases, and that was what she was missing a little bit of here on this side. And then hopefully you can see the way that this unlocked after, like I said, one correction. She was dealing with some boring kind of chronic pain behind her right shoulder blade or right scapula, and that slowly went away over the next several weeks after her first correction. Another one provocatively titled one correction. There's a young man about 17, 18, lost the cervical curve, turning into a reverse cervical curve between the second, which is here, cervical vertebrae or second neck bone, third and fourth. He's got a loss and a reversal of cervical curve here. Hopefully you can see the way that this is shifted after one unlocking of the cervical spine or the neck very gently. We certainly don't get this change always with everybody, but I again felt this change and I wanted to document it. And he was dealing with a lot of chronic neck pain and some other focus issues. Certainly the neck pain greatly diminished over the next several weeks. Moving on, not as dramatic in terms of the change in the time frame, but hopefully you can see how there is somewhat of a gentle curve here in this image on the left, but that curve actually increases and improves over several months of care. And what I want to point out to you, especially in this image, is the difference in the space between the back of the skull, which is here, and the first cervical vertebrae, which is here, and the space that's over here. What you're going to notice is the way that that first cervical orientation, or that first cervical vertebrae, the line of it changes as the curve comes back. And what we're doing here is we're actually creating more space at the back of the skull for the passage of all kinds of good stuff, but you have the brainstem becoming the spinal cord in this area. You have intervertebral arteries kind of coming up here, making two 90-degree turns. So it's nice to have a good amount of space in this area, which is what we can get when we see an improvement of the curve. Moving on to the next case, just want to quickly throw this one in here. Just shows a gentleman who cannot really move his neck into extension. And what I mean by that is he's looking up, his nose is up here, his eyeball's over here, he's trying to look at the ceiling. He doesn't really have a lot of movement because he doesn't have a curve. As a matter of fact, he's got a reverse curve. And then about 17 days later, you can see he's able to move his head back quite a bit. And this is important for the long-term health of the neck. He's going to have a lot of degeneration and arthritis, more likely than not, if he stays in this position where he does not have full range of motion in his neck. I want to throw this one in here. This is a case still ongoing. You can see the reverse cervical curve. This is slightly lower, between 4, 5, and 6, and then the improvement that's there. It still has work to be done here. Potentially this will change over time, but this is another individual that had a strong kind of boring pain in the mid-back, some lower back pain, and then some hormonal shifts that happened when we got her neck unlocked. This is just an interesting case that saw a change in the alignment between 4 and 5 after, again, one correction, and resolution of or improvement in knee pain and low back pain. And one final case here, just to make it fun for you, switched the orientation of the x-rays. Again, not bad, soft gentle curve, but that curve improves in a young man in his 30s. Hopefully again here you can kind of see slight change in orientation on that first cervical vertebrae here, how that creates a little bit more space between here and here than over here. And again, that was possible after 4 weeks. Again, my name is Dr. Zachary Ward. I am a structural upper cervical chiropractor in Auburn Hills, Michigan. If you're in my area, there's a phone number at the bottom of the screen. You can certainly call me and ask me any questions about this. Otherwise, you can certainly go ahead and look me up online. Go back to this image here, and you can look me up at liachiro.com. There's more articles, there's more pictures, there's more videos showing why alignment matters, especially in the case of cervical curve. Thank you so much for listening. Have a great day.